I'm very pleased to introduce you to Professor Vermorken and Dr. Saijo. Now, Professor Vermorken has been the Editor-in-Chief of Annals of Oncology since 2009. And what do you consider to be the major developments for the journal in 2009 and into the future?
Well, thank you for this question. I first would like to say my thanks to the previous editor of the journal, David Kerr, who is now the ESMO president, and also the founding editor, Franco Cavalli, who started this journal 20 years ago in 1990. So what I hope to do, and it's a pleasure and an honor, to follow them in order to see whether we can continue to bring the journal where it is now, and perhaps even further, I hope, being one of the leading clinical oncology journals in the world. I think that it's extremely important that there is a close interaction between ESMO and the journal, and I think support of ESMO will be crucial for the further development of Annals.
Thank you very much indeed. And what about some journal-specific developments through 2009?
Well, the plan is that we will have some change in structure, and I think that this is adapted to the way we think about how oncology is being handled nowadays. Mm-hmm. So we will have separate editors for each specific topic, which will be responsible for what's going to be produced in the coming years in the journal. And there will be also new topics like, for instance, translational research, which is getting more and more important at the present time. So we will have additional editors to the journal. And I think that change is important for the functioning, but also the quality of the journal. Overall, I think that a journal will be appreciated when it had a good service, when the content is okay, and when the access to the journal is easy. And I think I would like to mention here that we have now a newly open access procedure where people, if they want to read a paper without subscription to the journal, it's possible. If an author of a paper would like to have this online immediately, it's a possibility nowadays. So I think that these are important things. I think the service is mainly a result of a very dedicated review board and editors. And nowadays we are able to have a very short interval between the submission and the first answer, which is about 3 to 4 weeks.
Mm. Thank you very much indeed, Professor Vermorken. And can I also note that in 2009 the impact factor of the journal rose to 4.935, which is a continued testament to the excellent quality of the journal. And in 2008, Annals of Oncology and ESMO were very pleased to announce a very new and exciting development, which is a collaboration with the Japanese Society for Medical Oncology. And I'd like to introduce Dr. Saijo, the President Emeritus of JSMO. Thank you.
Thank you. We are very pleased about the partnership of JSMO and about the excellent access to top quality of papers that this provides for JSMO members. This is an excellent opportunity to exchange opinion and research across a global oncology network. We JSMO members will do our best to further improve the quality of Annals of Oncology and increase the number of members of ESMO.
Professor Vermorken, please could you tell me a little bit more about what it is that sets Annals of Oncology aside from other journals?
Well, I think that the success of the journal is based on the quality of the service, the content and the access. I think one of the new developments that we have is the open access procedure that we have now, which allows authors to have their paper very fast online, and which also makes it possible for everyone in the world, if they want to read that paper, to read it without a subscription to the journal. So I would like to invite everyone to send in papers and make use of this high quality procedure that we have now.
Thank you, Dr. Saijo, and thank you, Professor Vermorken. And I hope that, having seen this short introduction to Annals of Oncology, you'll be encouraged to become a JSMO member or an ESMO member, and to join the Annals of Oncology community as authors and readers, so that going on into the future, we can continue to play a pivotal role in the development of cancer research. Thank you.